Thank you, Richard. It's an honor for me to address colleagues on such an important matter, one that affects me daily and, as a consequence, my patients. I'm a diagnostician. I evaluate biopsies and excisions of skin by means of a microscope and my mind. My goal is to identify the nature of disease by evaluating its structure or morphology of each lesion. By its nature, a diagnosis is a selfish concern of the diagnostician. He must focus on every relevant fact of the case, the clinical diagnosis, the historical precedents in the literature, his own experience, and all opposing viewpoints. And there are many opposing viewpoints, all for the purpose of telling the patient, usually the clinician in my case, that the lesion is a benign neoplasm, for instance, a melanocytic nevus, or a malignant one, a melanoma. Or in some cases, and this is not too uncommon, one doesn't know for sure, but the facts favor one diagnosis or another. Why is this process selfish? It's because the diagnostician must look outward at the facts, but turn inward to his own mind, relying on his own judgment, taking the responsibility for the patient's life. Yes, he may be able to consult others on a difficult case, but this is just an extension of fact-gathering, gathering other opinions. Ultimately, he must decide in the privacy of his own soul. Considering how important it is for a diagnostician to be able to focus and concentrate on the process of diagnosis, and considering what is at stake in every diagnosis, that is life or death, he must be free to act, think, and be secure in his relationship with the referring clinician and the patient, so as much as possible, the proper diagnosis is made and the proper action is taken. Most of us who perform this kind of work love it. We love the challenge. We love being able to establish a diagnosis. Yet, the process of diagnosis cannot be touched in any fundamental way except to destroy it and to destroy the conditions for which it functions optimally. What are these conditions? Three come to mind immediately, but perhaps there are more. One, a well-prepared mind grounded in the liberal arts and the sciences. Two, one's experience with the kinds of problems encountered routinely in one's chosen field, and the ability to think beyond the routine so as to advance knowledge in the field. And three, political freedom based on the principle of individual rights. The first two parameters have been the time-honored mainstay of medical practice, at least in the modern era of medicine from the 19th century to the 1960s. As a consequence, physicians as diagnosticians have developed a strong sense of personal pride in their work, wealth from a successful practice, and a concern for the patient's well-being as well as the patient's privacy. It is not true that physicians made themselves wealthy by sacrificing their patients. Far from it. Both benefited. It was a trade relationship in every way, including when charity was extended to the indigent, especially prior to the Medicare and Medicaid era. During this period, for instance, the honest poor did not believe the care they received was theirs by right, but by trade, if nothing more than offering a thank you for the care they received. They understood on some level that the skills of the type offered by physicians were earned at a great price, and that neither could nor should be demanded of physicians without some kind of mutually agreed exchange. Well, that changed in the Medicare era. It has become much worse since I entered the profession in the 1980s, and there is no real trade relationship with patients free from intervention by government today. The government has taken on the role of the grantor of charity, or what they call charity, but there is no trade in this because the government has extorted physicians' labor, regulated their practices, and compromised their thinking by paying for services with stolen money, redistributed to them via the Social Security Administration. This brings me to point 3, political freedom in the medical professions. Let me be frank. We are not living under political freedom in the practice of medicine, which will not shock most of you. Here are some examples. Our prices are fixed by Medicare. Medicare drives the pricing of what remains of the insurance industry, the latter being blamed for many economic ills they did not cause in any fundamental way. Our industry is regulated beyond belief. The FDA, the licensing laws, both federal and state, and the arbitrary recertification laws are just a few of them. In pathology laboratories, from my background, endless checklists must be maintained with the specter of arbitrary inspection and the threat of license revocation, even when laboratories are reputable and have never been sued for violating anyone's rights. Private research is more difficult to do because so much money is funneled by the government into publicly funded research, often with laughable consequences if they were not so serious. What may shock you, however, is that there is resistance to the political freedom of the medical profession by the physicians themselves, with notable exceptions. In my sphere in St. Louis, I've observed little opposition to the huge bureaucracies such as the FDA, Medicare, Medicaid, the National Institutes of Health, the bricks and mortar version of the VA, or the CDC. Most physicians want them. I do not. I believe they exist because of the immoral principle of altruism. Even if one did not consider the individual rights violations and infringements involved by these institutions, at the very best, they're too expensive, too bureaucratic, and they don't deliver what they claim to deliver.